caffeine and coffee has a really similar history. Some studies tell you it's great. Another study tells you it's terrible. One doctor tells you it's good to drink. Another one says limited. So it's kind of like, well, what is it? Should I be drinking coffee or should I not? And I think traditionally, caffeine has been thought to trigger a bunch of stuff. It's been triggered anxiety, right? Too much coffee gets you jittery and anxious. That's a fact. Like I drink a cup a day, and any more than that, I'd be like, right? So there, and then too, with caffeine and coffee, one of the things, if you have overactive bladder or you have extreme prostate symptoms, typically we say, well, limit the caffeine, limit the coffee. So I think that what's happening here is you get two different messages, right? You get the message that maybe caffeine and coffee are bad for you, and then every now and then you get the message that it's good for you. So which is it? So that's what I want you to help uncover. So we'll uncover the science behind it, but then you have to decide what's right for you. Because if every time you drink coffee, all hell breaks loose and it's a terrible experience, well then, damn it, coffee's just not for you. But if you happen to be one of those people like myself that feels like coffee is more beneficial than harmful, then hey, then if it ain't broke, then don't fix it. So BPH, or benign prostatic hypertrophy or hyperplasia, is a really common condition. And it basically means an enlarged prostate without there being a cancer underneath it. And it's a common condition, and it makes it difficult. Sometimes it makes it difficult to urinate. Sometimes you find yourself urinating more often, but it's a variety of different urinary symptoms. And there's traditionally been a number of different medications that have been used to manage these symptoms, and of course, lifestyle changes. So the lifestyle changes we recommend typically are things like move more, exercise more, avoid alcohol, decrease beer intake, limit stimulants. Caffeine's a stimulant, right? So caffeine, which is found in coffee, tea, energy drinks, soda, chocolate, cocoa, caffeine is considered a stimulus because it actually stimulates the central nervous system, right? And it has actually been shown to improve alertness, focus, energy levels. So if something has been found clinically to improve alertness, focus, energy levels, then how could it be bad, right? Or is it bad? So as amazing as it seems, too much caffeine can actually stimulate anxiety, make you restless, make you have trouble going to sleep, and it can actually make prostate symptoms worse. So caffeine, though, traditionally, we've thought it inflames the bladder, right? If I go through a period where I got to stay up late, drinking too much coffee, now I'm rushing to the bathroom. Now, everything feels irritated, because what happens is whatever you're drinking and eating, and it's being cleared through your bladder, through your kidneys, and then into your bladder, if it happens to be something that inflames you, it sits in that bladder and it starts to inflame the tissue. So why all of a sudden now are we hearing of these studies that are potentially suggesting that maybe caffeine and coffee could reduce prostate cancer, right? And is it true? And what is it? So interestingly enough, coffee has been studied by so many different people in so many different countries that it's always actually been thought that that people who drink coffee are less likely to have breast cancer, they're less likely to have colon cancer, right? So when it comes to prostate cancer, though, the verdict was kind of out. There was a lot of different information in terms of yays and nays. So recently, I think it was actually last year, a systematic review with meta-analysis of cohort studies. So this is basically kind of a big study that looks at a bunch of other studies and kind of tries to see, okay, let's find the best studies and let's see what they're saying, and let's write a report and analyze the data in those best studies and come back to the people and give them the information and let them know what we think about whether or not coffee could help reduce prostate cancer, right? So when this study was actually conducted, 16 studies made the cut, right? And over 1 million gentlemen, over 57,000 cases of prostate cancer were analyzed. And what they actually found is that the more coffee men drank, the less likely they were to have developed prostate cancer. Yep, the more coffee that they drank, the less likely they were to have developed prostate cancer. Now, with that being the case, we find high levels of caffeine in coffee and tea, right? And this actually meta-analysis wasn't on tea, but it was actually on coffee. And what we know is that 3/4 of all prostate cancer cases occur in developed countries like the United States, right? And what we also know is that coffee is kind of one of those drinks that is worldwide. You know, people in most cultures, we have pockets of people who are drinking coffee. So, what is it about coffee that seems to be cancer preventative, right? Like, what is it about it? Like, why is it that coffee could be this? Now, we've known that coffee is known to increase glucose metabolism. So what does that mean? Like, you take some sugar in, your body is better able to use that sugar. Coffee helps it, right? We've also known that coffee is anti-inflammatory. It's got some antioxidants in it. We also know that it helps the sex hormone binding globulin levels go up, right? So there's so many different benefits to coffee. So what I wanted to do is just kind of show them to you, lay them out here. So coffee actually has chlorogenic acid and caffeic acid, right? And those two acids are actually known antioxidants. So what we know too is that the human body actually absorbs those two acids, and those acids are there doing their thing. Now, so what do we want? We always want something that's going to help decrease inflammation, right? We always want something that's going to help repair damaged DNA, because on a daily basis, everything is happening that's helping damage our DNA. So what can help repair it? And so chlorogenic acid and caffeic acid are thought to block DNA damage. They are also thought to inhibit the formation of cancer-causing agents, right? So that's why coffee also, I mean, so, you know, there's books written on this, on how fantastic coffee is. If you follow Dave Asprey, he has a whole diet program and a whole lifestyle program based off of the base of organic coffee. So coffee increases sugar metabolism. It increases sex hormone binding globulin. It has been shown to increase testosterone. It's thought to decrease the risk of cancer in both colon, liver, and breast. And they think that it's all happening because of its antioxidant effects, particularly as it relates to chlorogenic acid and caffeic acid. So if you happen to be a coffee drinker, the only thing that I would suggest is if you are having some bladder-related symptoms, you might scale back on it. Only other thing I would say is if you are a coffee drinker, you know, and it's keeping you up at night, or if you're having anxiety, maybe cut down on the amount of coffee that you're having. But the biggest tip I have for coffee drinkers is try your best to get an organic blend, because coffee actually can harbor a lot of mold to it. Get an organic blend and invest a little extra in the coffee, right? Because now that you're seeing that coffee is an antioxidant, damn, it might as well be an herbal supplement at this point, right? That you want to actually make sure that you're getting a good quality coffee that's organic and doesn't have any mold, right? So awesome.